Okay, today I want to talk to you guys a little bit about sinus lifts, what you can expect afterwards, and then things you can do to keep the sinus lift healthy as it heals. So the first thing I want to do is briefly describe the two types of sinus lifts. There's a vertical and a lateral. The vertical is performed through the hole that was drilled for your implant in a vertical direction. The lateral is made from the side, sort of above and lateral to where the implant is placed. The lateral is generally reserved for larger bone grafts. So let's talk a little bit about what you can expect after a sinus lift is performed. So as far as pain goes, I mean, I just drilled a hole through your jawbone inside your sinus. So I would expect you to have some pain associated with that. Pain's going to be for the first 3 days or so. Swelling's going to be similar. Swelling for the first 3 days, you should expect that. But then it should start to decrease by day 4 and then definitely go down after that. As far as bleeding goes, you're definitely going to bleed the first day. I would anticipate you may have a nosebleed as well, actually. That's not uncommon for sinus lift procedures, but I would anticipate the majority of the bleeding to be complete by the end of day 2. As far as bruising goes, you know, most of the time, especially if a lateral window is performed, you're gonna have some bruising associated with this. The bruising is gonna show up anywhere between 2 and 3 days after the procedure was done. And then that bruising hopefully goes away by 7 days, but sometimes it can last up to 14, especially if additional bone grafting was done on the outside of the ridge in combination with the lateral sinus lift. Most of the time, you won't find much bruising associated with a vertical sinus lift. As far as sutures go, almost always we're going to be using sutures that don't come out. So 2 weeks after the procedure is most of the time is when you're going to come back and have our office remove the stitches. Okay, so a couple of strict no-can-dos. The sinus lift is a special one because the first thing I'm going to start this off with is by saying you cannot blow your nose or forcefully sneeze through your nose for the first 2 weeks after the procedure's done. I know this sounds kind of weird. How can I not sneeze? It's by accident. Well, if you are going to sneeze, just make sure that you sneeze with your mouth open and all of the velocity of the air comes through your mouth and instead of your nose. So that should be just fine. Like most procedures, don't rinse for the first 24 hours. Don't spit, suck through straws, or touch the surgical site. If additional bone grafting was done on the outside of the lateral window, then don't apply any pressure or rub the area afterwards. Definitely do not smoke or drink for the first 3 days after the procedure. And it would be ideal if you totally quit smoking altogether. Smoking definitely decreases the success rate of your implants and your bone grafting in the long run. Please don't exercise, definitely for the first 5 days after the procedure. You know, I've had patients tell me that sometimes if they bend over, it causes a nosebleed. So think about what exercising would do. All right, so absolutely no hot foods or hot beverages for the first 14 days. Cold only for the first 24 hours, and then you can move to warm food and warm beverages approximately 24 hours and later. Avoid spicy foods. Avoid chips, popcorn, avoid carbonated drinks, and acidic beverages like orange juice and grapefruit juice for the first 14 days after surgery as well. Okay, so what are a couple of the things that you can do or that you should do to try to keep this graft healthy? Well, if you're able to take decongestants, I recommend taking not only a nasal spray. We recommend Afrin or the generic brand of Afrin. I think it's oxymetazoline. As well as some sort of oral decongestant like pseudoephedrine, if you can. Some of you will have cardiovascular conditions that don't allow you to take that, in which case definitely avoid it. You'll be fine. We just like to keep everything inside the sinus moving since we've caused a bunch of inflammation inside of it. As far as cold packs go, like most procedures, we're going to recommend that you apply cold pressure for the first 24 to 36 hours, 20 minutes on, 20 minutes off with a barrier between it so you don't cause additional trauma to your face. I've already done enough with the sinus lift. As far as medications go, I want you to take all medications as prescribed. In the case of a sinus lift, more than likely we're also going to recommend that you pick up the Afrin nasal spray and pseudoephedrine, or some sort of antihistamine with pseudoephedrine in it. And we're going to have you going to have you use the Afrin nasal spray for the first 3 days, and then the pseudoephedrine for the first 7 days afterwards. Just make sure you take the pseudoephedrine early in the morning, or you won't be able to sleep afterwards. It kind of keeps you up. As far as oral hygiene goes, again, we're going to rinse. We're going to do absolutely nothing, no rinsing for the first 24 hours. You can brush your teeth as long as it's nowhere near the site. You can do that in the first 24 hours. And then moving after the 24-hour period, use a soft toothbrush. There's really no reason for you to brush the actual surgical site itself, although you can brush the teeth just next to it. And then under no circumstances should you use a water pick for the first 3 to 4 months after this procedure is performed near the grafted site. As far as your diet goes, for the first 24 hours, remember, beverages and food cold. After that, you can move to warm for the next 14 days. Make sure that what you're eating is soft. For example, you could do pastas, you could do stews, you could do soup, slow-cooked meat, slow-cooked vegetables, and make sure that you chew on the opposite side of where the sinus lift was performed. And then kind of in the long run, so most sinus lifts are done at the same time as the implants are placed. But in the event where they're not, because there's simply just not enough bone to get stability of the implant, the sinus is going to need to heal anywhere between 4 and 6 months before the implant is placed. And the time frame is specific for every patient and the amount of bone that's available to place the implant into. So that pretty much wraps it up. Hopefully this has given you some helpful information on what the types of sinus lifts are and what you can expect from each of them. And hopefully this helps you off to a fast and speedy, which is also fast, recovery. Thanks.